conversations. A directive by the central government has declared black fungus as a notifiable disease, which means that by law now, hospitals and states have to report all the cases that they're seeing. This is being done so that guidelines can be made to fight this disease, which has a mortality of over 50%. Today, we speak to Dr. Sanjay Dhawan, Senior Director and Head of Department Ophthalmology, Max Panchhill Park, New Delhi, and Dr. Joseph, Chief of Interventional Pulmonology, Amrita Hospitals, Kochi, about the causes, the management, and the outlook of this deadly disease. Welcome, doctors. So let's start with you, Dr. Dhawan. What does a notifiable disease mean? Does it mean that now all hospitals by law are required to report all the cases that they see? And
Yes.
is it done so that guidelines can be prepared to fight this deadly disease?
That's correct, that anybody who diagnoses the case of mucormycosis or black fungus needs to report to the authorities. The reason is that they want to put every case under surveillance and monitor their progress. That is done whenever there's any epidemic of any disease which spreads from one person to the other. So the black fungus has also been declared an epidemic now in India.
Dr. Joseph, how many cases of black fungus are you seeing at your hospital?
Okay, good question. Prior to COVID, black fungus was an extremely rare entity. It was not so commonly seen. If you ask me, I would have been seeing maybe 1 or 2 cases in 6 months. So the volume of cases was too less prior to COVID. But ever since the pandemic has set in, especially due to the excessive usage of steroids and all those things, the number of cases reported in different states is steadily growing up. So initially it was reported primarily in Maharashtra, Gujarat and Delhi. Now slowly it has started to peak in most of the states. In Kerala, from where I belong, we have reported close to around 25 cases in the past 10 days.
Dr. Dhawan, what is it like in Delhi at the moment?
It's quite severe. I think we've had something like 262 cases of black fungus so far in Delhi, and which is a very, very high number. And as Dr. Joseph said, that it was a very, very rare disease earlier on, that one would get to hear about it or see only once in a while. And I mean, I would not even seen once in 6 months a case like that. But now it's become a very, very common thing. And yes, as Dr. Joseph said, that one of the factor is use of steroid, but that is probably not the only factor, because we have been using steroids for a long time in various other conditions. People who have had diabetes, uncontrolled diabetes for a long time for various reasons now. Diabetes have been given steroids also, but we have never seen such a high incidence of this disease. The fact that the incidence is so high, and there has to be, we need to look further deeper into the pathology of this disease to see that what exactly is the reason which is causing it. It will be, I would say, too premature to jump to a conclusion that steroid is the main factor. Steroid is probably not the main factor. There are other factors too.
Actually, I wanted to know, is there a particular category that's getting it? Like, for instance, we were reading about people who are diabetic. They seem to be getting it. But is there any other criteria? Has that been, has that come to light?
See, it's seen mainly in moderate to severe COVID disease. More so in patients who are diabetics, patients who have been given on a long dose of long-term steroids. But it has also been seen with patients who have not been given any steroids, who are not diabetic, and who had a moderate disease as well. Which is a surprising factor, because those cases, though there may be a small number, but they put a big question mark on the pathology, that what exactly is the reason why this disease is happening. But yes, diabetics, use of steroids are definitely known factors which predispose to occurrence of this disease. But the behavior of this disease in the present COVID pandemic seems to be different from what we have known about it in the past.
Dr. Joseph, are you seeing younger patients also with black fungus, or is it only a certain age group, or this is not a criteria?
Okay, I would like to add a couple of points to what Dr. Dhawan had mentioned. Mucormycosis, it's an extremely rare entity. Apart from diabetes and people who are on steroids, there are certain other category of patients who are more prone to develop this particular disorder. Any patient, let it be of any age group, who are immunosuppressed or immunocompromised, that means the immunity is towards the lower side, so they can ideally suffer from this particular disorder. So the examples are the people who are suffering from various malignancies or cancers, then people who have undergone any organ transplantation, like let it be liver, kidney, heart, lung, or any other solid organ transplantation, or people who have undergone bone marrow or stem cell transplantation, as well as uh, again, coming back to the diabetic population, also people generally with uncontrolled diabetes mellitus, because studies have proven that India has got a huge burden of diabetes patients, and those patients without proper glycemic control, or if they're steroid, so the diabetic patients who are not been managed properly with significantly elevated blood sugar levels. So these are the patients who are more prone to develop a mucormycosis. It's not only diabetes or not only COVID. There are certain other group of people also. Irrespective of the age, it can affect anyone with suppressed immunity.
Right. So coming back to you, Dr. Dhawan, you said earlier that it is steroids, use of steroids, and perhaps too much use of it is one of the causes. Could hygiene and environment be another cause? Because there were some people, experts, who were talking about how oxygen that is being given to patients, that the cylinders need to be in a clean and disinfected environment, and that is perhaps not being done, or in even the ventilators for that matter. Can I have your views on this?
I would say that that's a very, very simplistic approach view to it. No, I don't really agree with that. The reason being that oxygen has been used in various patients, in various conditions all across India and the world, for always. People have been admitted in the hospitals for always. People have been put on the ventilator for always. This fungus, these spores are present everywhere in the environment. So it's nothing to do with hygiene or no hygiene. Spores are there in the air at all times. So for example, I think the spores are more commonly found in Kerala, where the incidence is much less than in the North India. It started first in the Northern India, Maharashtra and Delhi. Kerala, I'm surprised that Kerala was also reporting cases, because so far I was told that Kerala does not have any case of mucormycosis so far. While the environmental conditions are very conducive to any fungal growth in Kerala, humid environment, a lot of vegetation and all, everything in the air. So it's not the thing. It's a very simplistic view to say that it is the oxygen, because the same conditions are used everywhere, and it's not the oxygen or the water used to humidify. That may be one small contributory factor, but that is not the main reason. Main reason, as Dr. Joseph said, is the breakdown in the immunity, and in this particular disease, we're seeing there's a breakdown of T cell immunity, or what is called the cell-mediated immunity, which is seen very, very uncommonly. In a diabetic or use of steroid or immunosuppressants also, it is the B cell immunity which gets affected more than the T cell immunity. But in this disease, there's a breakdown of the T cell immunity. There is increased iron available to the fungus growth, in the form of ferritin. There is an endothelial damage to the blood vessels. And so the ground it gives a big opportunity for this fungus to grow. And this fungus is actually not a virulent organism, but an opportunistic pathogen. It will grow or invade the body only when it gets the right opportunity, which is being provided by the COVID disease, far above what can be explained by use of steroids or environment or the oxygen or the diabetes.
Coming to you, Dr. Joseph, could you tell us a little bit about the symptoms? What are the symptoms when it starts early on, and then how do they progress?
Mucormycosis can literally affect any part of the body. So there are 5 different entities if you subclassify on the basis of symptoms. So first and foremost, it predominantly affects the sinuses and your brain. So it is called as rhinocerebral, or the ones which affects your sinus or the brain. That is the first entity. So if it affects the brain or sinuses, so the symptoms would be nasal blockage, the blackish kind of spots over the nose, then sneezing, severe headache associated with vomiting, and the people will be disoriented. These are the primary symptoms when it starts to affect either sinus or your brain. Now, coming to the next entity that is called as a pulmonary mucormycosis, or the one which affects the lungs. So once it starts to affect the lung, the patient often suffers from cough, breathing issues, as well as high-grade fever. The next entity is the gastrointestinal mucormycosis, or the ones which affect the GI system. So the gastrointestinal mucormycosis are the ones which affects the stomach and related organs. It's an extremely rare entity. Generally, it is seen in pediatric age group among children who have been on steroids or any other antibiotics for a long time, are the ones who develop gastrointestinal form of mucormycosis. The next entity is the cutaneous mucormycosis, or the ones which affect your skin. In case of cutaneous mucormycosis, again, this is also an extremely rare entity. How it happens, it generally, if the person is having any cuts or bruises or any form of skin ulcers, the fungus can get inoculated through that particular spot, and it tends to affect the skin. It can be localized, or it can be generalized as well. And the last entity is the one which is called as the disseminated mucormycosis. Disseminated means it starts with one organ and gradually it spreads to other organs as well. And this is the severe entity which the fungal infection gets transmitted to one organ to the next one via blood.
So now, if we were to talk about the treatment, Dr. Dhawan, could you tell us a little bit about it? Also, there's been, all this conversation about different drugs and some of them going up into lakhs of rupees.
The treatment is in the form of two folds. One is the surgical treatment, or what we call the debridement, where the bulk of the fungal mass and the dead tissue has to be removed. That is the most important part, because the drug supplied through the intravenous route will not reach this area, will not reach the bulk of the fungus, will not reach the dead tissue. So this has to be removed. Then one has to give an intravenous antifungal drugs. I don't want to name the drug because for the fear of it getting hoarded and black marketed. So, but the drug, which is, of course, most people know that, is the drug of choice is an intravenous antifungal drug, which is to be used in very, very high doses for long enough time for the residual fungal spores to be killed by that. The drug also has got a lot of side effects and toxic, so it has to be used very, very carefully in the hospital environment most of the time. Once patient recovers and gets discharged, it can be given in the home setting also. But to start with, the treatment has to be in the hospital. But the mainstay of treatment is first the surgical debridement or removal of all the dead tissue and the fungal mass. And along with that, the intravenous antifungal. In later stages, once the recovery is well on the way, then oral antifungal drugs can be used to taper off the treatment for the antifungal. But this is how the treatment plan works now. The problem is that this disease gets picked up a little late by the time a lot of damage has been done. So the surgery becomes very, very mutilating. You have to actually remove the tissue, and then that requires reconstruction and plastic surgery at a later stage. And Dr. Joseph rightly said that it usually starts from the nose. From there it spreads. So the paranasal sinuses, or the hollow spaces around the nose, are what it affects and gets filled up first. From there it spreads upwards to the orbit, that is the eye socket, and from there back and up to the brain. So this is how the usual spread takes place, and once it invades large blood vessels, then it can actually spread through the bloodstream also and become a disseminated mucormycosis, as told earlier.
So I also want to know, do we have enough medication for this in Delhi and in Kochi at the moment? Do we have enough?
I'm afraid people have already started hoarding it, and people already black marketing has started, which is a very, very sad thing. I never wanted that the drug name should come out in the public, but it did come out in the public. And now a very sad state of affairs has happened that there's a black marketing happening of the drug.
But do you have enough supplies if we talk about Max at your hospital?
Yes, at Max we have fortunately right now adequate supply for our inpatient care.
Yeah. What about you, Dr. Joseph?
As of now, we have adequate supply, and like how Dr. Dhawan had mentioned, the primary treatment of choice is surgical approach, because in spite of giving the adequate dosage of antifungals, most of the time the drugs may not reach the necrotic tissue. So the primary treatment of choice is surgical debridement or surgical resection of the affected site. which will be followed subsequently by the antifungal therapy. But the only issue would be the cost, because in a resource limited setting like India, I'm not sure regarding how many people will be able to afford the antifungals, because it's extremely expensive, and it's a prolonged line of therapy. Most of the people will require injections for up to 1 month, and which will be followed by the oral antifungals for another 2 months. So that the treatment duration would be close to around 3 to 4 months. And again, cost is a limiting factor.
While researching and reading about this, I noticed that, why do we have such a high caseload here in India as opposed to, say, in Italy or in Brazil, or cases are not being reported from the United States for that matter. So would you like to take that, Dr. Dhawan?
Well, it's a big question mark for us, and we have no clear-cut answer that why is this happening. It's probably to do with the present strain which we are experiencing right now. This strain is causing some sort of a pathology in the body which is predisposing the body to this fungal infection. There's no other explanation for that, because steroids have been used in the West as well. People have had diabetes in the West also, and there's been virtually no report of mucormycosis from there, and we have suddenly a surge of those cases. Last year, in the first wave, there was no such phenomena happening. There's no case of mucormycosis reported at all. Suddenly, in the past 1 month, there's a surge of cases, and it's become an epidemic proportion. So these are the questions which remain unanswered, and the only possible hypothesis or guesstimate that I can give is that it's got something to do with the present strain of virus is causing some sort of pathological change in the body, some breakdown in the particular immunity which predisposes the body to an infection by a fungus. It's also causing something called respiratory acidosis, increased ferritin levels, breakdown of the T cell immunity, endothelial damage to the blood vessel. All this, plus of course it leads to an increased blood sugar also in itself. Then diabetics, use of steroids, use of other antibiotics. These are all multiple factors, but which is the most important factor and what is the treatment for that, we still don't really know.
Dr. Joseph, would you like to add to that about why we're seeing?
Yeah, even prior to COVID itself, India contributed almost around 70% of the global cases of mucormycosis, because maybe because of the tropical climate, as Dr. Dhawan mentioned about the increased moisture content in our land. Some factor is contributing for the mold to grow in most of our environment. And ever since COVID has set in, yes, the number of cases reported has gone up. But again and again, I feel that the rationale of using steroids in India is different from the Western countries, because unfortunately, most of the centers across India are not following the guidelines, even for let it be mild, moderate, or severe. Each and every patient has been on steroids. So that has to be stopped. Only patients who require oxygen support, or with significant pneumonia, or the severe category who are getting admitted in the ICUs, required to be managed with steroids. So let the other group of patients who are sitting at home should strictly avoid using steroids, because I've been getting a lot of prescriptions as well as inquiries from so many patients that they'll be calling up and they'll be sending the prescriptions, and almost literally 90 to 100% of the people are on steroids. So that has to be stopped. So the law has to be framed in such a way that the people should be treated by the doctors, not by the pharmacist or the person who is supplying the medicine from the pharmacy. Because people are going to the pharmacy, the pharmacist is prescribing, he is the person who is deciding what sort of treatment has to be given to the COVID patient. So that has to be stopped. So one of the reasons why the number of cases are less in the West is that in most of the countries, they follow guidelines. The patients cannot be managed by a pharmacist or any other alternative medical practitioners in other countries. But in India, unfortunately, the situation is different. So that scenario has to be changed. These are we should take some lessons from the present pandemic. At least in the future, we should be much more prepared.
What is white fungus? This is being reported as well. What is this white fungus, and how is it different from black fungus? There were some cases, the media has reported certain cases in Bihar of white fungus. Dr. Dhawan, would you like to take that?
I'm not fully aware of it, but I think it's being talked about is the candidiasis. And any fungal infection, any opportunistic infection will become more common in the scenario where the immunity of the body is decreased. No, whether it's caused by steroids or diabetes or other thing, but the immunity goes down, all the infections become more and more common. But patients are also being given antibiotics, so bacterial infections are taken care of. And in fact, the elimination of bacteria also predisposes to the growth of fungus, because some bacteria inhibit the growth of fungus. So there is a synergistic effect that happens now. So once the bacteria is gone, fungus gets an opportunity to grow further. So other fungus will also grow. I think Dr. Joseph may know a little more about that.
Okay. There are few cases again reported from the north regarding the white fungus. So the let it be white or black fungus. The difference is that the black fungus means that particular fungus has got the capability to produce a pigment called melanin, which is obviously like brownish black in color. That is why it is called as black fungus. And the other entity is producing a different pigment. But the number of cases which has been reported is hardly one or two. So as of now, it is not alarming compared to mucormycosis.
Right. So now coming to my last question, what is the outlook? What do you see? How do we, when will it sort of start to decline? What can we do in the meantime? What kind of support should hospitals be given? Let's start with you, Dr. Joseph, and then we'll.
Okay, I would focus more on preventive strategies because as of now in India, there is a major outbreak is not set in. So let's primarily focus on preventive strategies to control the further spread of this disease. So first and foremost, the person should not panic about the disease because a lot of information has been passed on social media regarding the black fungus. It's a deadly fungus which might kill the person, and it is spreading rampantly across India. So people should rely on trustworthy information. Try not to spread any fake messages regarding so and so infection. That is number one. So person should not panic. Again, even though it's a deadly fungus, it's an extremely rarely reported. Even in India also, we have cases only maybe I would say less than 1,000. Number two would be the people who are suffering from diabetes mellitus, who are on insulin. They should monitor their sugar levels properly, and if required, consult a nearby doctor and take adequate help. Those people are on insulin. The dose has to be monitored and given accordingly. Number three would be if the person is suffering from COVID or post-COVID, those who are on steroids, the sugar level has to be monitored adequately, and if required, the insulin has to be given. And number four would be kindly avoid giving steroids to people who are suffering from mild variety of COVID disease, and that is the people who are sitting at home or the people who does not require any oxygen support. Steroid has to be mandatorily avoided. Number five would be that most of us know that this particular fungus is commonly seen in various parts of the environment, especially it is seen in on compost, leaves, moist environment, as well as at construction sites. So people who are more prone for this disease, we had already discussed regarding the risk factors for developing this particular fungal infection. So that people who belong to that risk category should wear proper mask, and if they're going to any construction sites or if they're dealing with right now we have seen in the media that people are taking bath in cow dung, they're drinking the cow's urine and all those things. So such kind of practices has to be avoided because it is proven that mucormycosis fungus can be present in cow dung as well. So such kind of practices has to be stopped. And if there is any skin infection or any ulcers or cuts or bruises on the skin, that has to be properly covered because the fungus also can track through that. And the final point would be that this is a lesson we have to take it seriously because people who are suffering from COVID or any other related issues should consult a doctor, not preferably an allopathic doctor, not any other alternative medical practitioner, or people should not rely on pharmacies to get treatment for COVID because preferably we all should follow what is mentioned in the guidelines. Only then it can be taken care of. Kindly avoid using steroids in mild variety of disease. That is the take-home point.
Right. Dr. Dhawan.
I completely agree with whatever Dr. Joseph has said, that prevention is the key factor right now. And although today it has been declared an epidemic and become a notifiable disease, and I think probably the cases have crossed 1,000 in India, but anyway, still the number is not really huge. It's time to take preventive action. All the things that Dr. Joseph said, and I would actually completely agree with him that more regulatory steps have to be brought in so that the access to drugs should not be so easy. Only people who are authorized to prescribe a drug should prescribe the drug, and only on authorization or proper prescription should the patient get the drug. Otherwise, there will always be possibility of misuse. So misuse is not happening where, say, a physician is guiding the treatment. Misuse is happening outside, elsewhere. The examples which are already given by Dr. Joseph. So that misuse of steroid has to be completely avoided, because although it may not be the main factor, but it's a very, very important factor historically in this disease. So we have to control that. People have to take care of their health, their environment, and mild disease is where the oxygen is perfectly fine. Those people do not need steroids, should not be given steroid. Environment should be kept clean. It will be a good idea to add some sort of antiseptic to the humidifying agent for the oxygen that's being advised. Methylene blue is the agent which is being talked about. Use of an air purifier in the room where a COVID patient is living can be thought of, should be considered. And of course, all the other precautions that is being talked about for prevention of COVID also work for mucormycosis. Use of mask, hand hygiene, social distancing, all that is required. We have to first prevent COVID. If we prevent COVID, we are automatically preventing mucormycosis also. So the emphasis has to be greater on the prevention of COVID itself, and all the things that are being talked about for the last 1 year by the government, by the hospitals, by the media, those precautions need to be taken. And media's role is also to create more awareness amongst people to not seek advice or treatment from unqualified or unauthorized individuals. Now, whatever form of pathy they want to go for, it's fine. So if they want to go for Ayurveda, let them go for Ayurvedic physician and be treated by the Ayurvedic drugs only, keeping in view all the possible implications of that. But if they want to be treated by an allopathic, in allopathy, they need to consult an allopathic physician with a proper prescription and proper guidance should they get their medicines.
Right. So to sum up, cases are rising. We need to be cautious. People don't need to panic. Please consult a doctor. Understand what your physician is saying. Only then use steroids and take care of hygiene. These are the key factors by which we can at least prevent mucormycosis or black fungus, and stay safe and stay healthy. Thank you so much, doctors. Thank you so much for your time. This was very informative.
Thank you for inviting us on your show. Thank you very much.
Thank you.